Hi, everybody. Welcome back to Facebook Live. Sorry about the delay. Lots of technical difficulties today with the storm, and the health department is closed today. So I'm doing this from home. We're closed because of lack of power. Am I in the middle? Okay. So we'll get the data started, and then since we don't have access to some of your questions submitted earlier, we apologize. We're just going to take live questions today. So if you have something that you want to ask, now is the time to type it in and get it to Elise, and she'll ask me as soon as we're done here with the data. So we've crossed over the 20,000 mark for total cases, up to 20,260, with 448 deaths. Again, hovering around that 9 or 10% case positive or testing positivity rate, with about 55 to 60 average new cases per day. We have 390 new cases in the last 7 days. And the next slide. So this is our epi curve. You can see again this very slow, steady increase. Data throughout the state of Michigan continues to show us increasing in case rates. I believe I saw that St. Clair County at a 44% increase rate from previous testing. And so we do have the unfortunate situation where we're looking at this increase, wondering whether we'll plateau, whether we'll spike, or whether we'll start coming down. And it's just not clear, although statewide it appears we're continuing to climb. Vaccine data is pretty stagnant, although we had an increase in first-time vaccinations this time. We had, in the week of September 5th, we had 370 first doses. And the week of September 12th, last week, we had 412 first-time doses. So we are seeing some increase in uptake in vaccines. And then our school quarantine guidance, which has created lots of confusion because I'll admit it's complex, although we tried to take all of the quarantine guidance that was available through the CDC and MDHHS guidelines and create what we thought was the easiest options for individuals. So obviously we took a 10-day absolute quarantine. And by the way, 14 days is still ideal. If you're immunocompromised, if you have other medical issues, 14 days is still ideal. 10 days is acceptable without testing, but you can get out of quarantine in 7 days with a negative test on day 5 or greater. And that is for everyone, regardless of age, masking status, etc. Age. And the situation with masking is related only to schools. So if you're in a school environment, which we have greater concerns about because we have a bunch of mostly unvaccinated individuals in an enclosed environment over a long period of time, we have options available. If they are fully vaccinated, they can remain in class with enhanced monitoring and ideally some testing during those initial phases early on. And then if we have a school environment where everyone is masked, we can also allow individuals to stay in the classroom with a testing option. However, the situation we have here in St. Clair County, where masks are generally not worn by very many people at all, then we are still left with the 7-day or 10-day option. So in a classroom at this point where the majority of individuals are unmasked, exposures would be asked to remain out of the classroom for 7 days and then come back after a negative test. This is on our website, this guidance, and it has not changed. It hasn't altered at all, and we're going to just kind of stay the course with this until there's some compelling evidence to suggest to us that there's good reasons to forego it. All right, next slide. And I wanted to talk about vaccines because a lot of people are saying, well, why bother vaccinating if you can still get and transmit COVID if you've been vaccinated? And the simplest answer is if you're vaccinated, There's two simple answers. One is if you're vaccinated, you have a much, much lower risk of having breakthrough infection, and you can only transmit COVID infection if you are in fact infected yourself. 1% of the vaccinated population actually gets COVID. So vaccination does strongly protect you against getting COVID or giving COVID to other people. It's not a guarantee, but it does help a lot. Also, we know that it markedly reduces the potential for being hospitalized. I can barely read this, so I got to look at my thing. Markedly reduces your potential for being hospitalized, and you can see that in the breakthrough death rates on the right-hand side. So those, the light blue line is the unvaccinated, the dark blue line is the vaccinated. You can see dramatic differences in both hospitalizations and death rates on those. So vaccine is still our go-to best evidence, best approach. Other mitigation strategies like distance and masking and ventilation and hand washing remain important because all of them together give you the best chances of not getting COVID. Next slide is the question we're getting a lot as well. Why aren't we using natural infection as a proxy for how many people are immune? Of course, if you've had a recent infection in the past 90 days, we put you in that same category as the vaccinated. We don't require quarantine, just watchful monitoring, because reinfection shortly after an infection is considered rare. But I just want to say that the response, our body's response to a natural infection, is not really consistent. And there's lots of emerging evidence that suggests that there's a significant amount of people who get infected who don't have good immunity after a natural infection, which is why we recommend people to get vaccinated even if you know you've had a previous COVID infection. Vaccination immunity is much more predictable and much more robust. So you'll see here some of the more recent studies that have come out that have kind of guided this decision. I'll also say again that one of the reasons we don't just add the number of cases that we are aware of to the number of vaccinated individuals and say, here's our immune status. One is this reason right here that I have in front of you. And the other reason is because we have a lot of people who have been infected and go on to get vaccinated anyways. And so how you can't count them twice. And we have no really good way of differentiating the number of vaccinated people who've had previous infections. So you just can't add them together. All right, our dashboard is always available. It's updated regularly. And I want to remind everybody that we have an FAQ section for a lot of these frequently asked questions. We get the same questions a lot. How come you don't do this? What do these numbers mean? Or, do you really count, do people who die of death of COVID, are they really COVID related? And we answer those questions in our FAQ, and we're going to keep directing people back to there. If you send us a question that's not on the FAQ, be patient. We will get it onto that FAQ section. And if it's really something that needs to be addressed personally, directly back to you, we will attempt to do that as well. I don't need to tell you that we get a lot of calls and a lot of emails and a lot of questions, and our staff is really quite busy right now with everything they have to do, investigating cases and keeping up our workload, trying to keep ahead of it. So it's not really an excuse, but it's the reality of the situation. So we're trying to respond to your questions at the same time, continuing to stay on top of all this. So Elise, do we have any questions?
Yeah, the first one. Well, I see that we put up one. Linda said, "Thank you, Doc, and all your staff for all you do." So thank you, Linda. But the first question is from Marilyn. Could you please go over possible side effects from second COVID shot?
Side effects from second COVID shot, first COVID shot, if you get a booster, they're probably all going to be pretty likely. I have not seen any data that suggests adverse events or side effects from a vaccine. These COVID vaccines is better or worse after the first or the second. So after every vaccine, I would say anticipate a day or two of a sore arm, fevers, malaise, things of that nature. They're generally very short-lived, easily managed with a little rest and fluids. And if you're really miserable, go ahead and take some Tylenol or Motrin. But those side effects are the ones that are clearly documented in the clinical trials. More serious side effects, as we have talked about many times, are extremely rare, generally occur in the first 30 days, and have been limited to those things that we've talked about already with the myocarditis in adolescent boys, which is only a few cases per million. We have the J&J thromboembolic event, and I think that's it. I might be missing something, but extremely rare, serious adverse events. So just be prepared 24 to 48 hours after your any dose, first, second, or beyond, that you may have some sore arms, some body aches, some temperature, things of that nature.
All right, thanks, Doc. Next question is
Mm-hmm.
from Irving. Where can I find a breakdown of COVID deaths by age group?
Oh, that's a great question. I'm going to kind of defer that to my data guy. I don't know that we have that on our dashboard because, quite honestly, I don't know. I don't think we have that on our dashboard, although I think it exists.
Yeah, Doc.
Oh, there you're there.
State,
Okay, I was going to.
yeah, the state has provisional COVID deaths listed by age, and we can get you the link to that through I believe MDHHS.
So we'll get that posted. Elise, when questions come in, we got to respond to them. Can we just post them on this Facebook page?
Yeah, we'll reply to your comment, Irving.
Okay.
Okay. Next question is from Lindsay. Lindsay, do we know how many of the 390 this week that tested positive were fully vaccinated?
I can help with this.
Yeah, we do. Mm-hmm.
We have 14 people so far out of the 390 that are breakthrough cases. That's obviously provisional. We still have to do some more, case investigation and follow up to determine if.
So I can tell you all along, our breakthrough cases, despite anecdotally, we hear from people all the time that says, we had all these people vaccinated and they're all positive. But over time, when we look at the data, and it's scrubbed and clean data, and we know it's reliable, our data in St. Clair County is very similar to the states and the nations where, breakthrough cases are occurring, but they're considerably less. They're quite rare compared to unvaccinated. So nothing weird going on here in St. Clair County that I can tell.
Okay, next question is from Nancy. Have the schools around Port Huron have any new cases? And when will the 65 plus be available now that it has been approved? I'm assuming she's thinking the booster.
2 questions, right? Okay, so yeah, of course there are cases all around. So we have cases in every school district, right? And what we're watching for is whether or not cases start to accelerate, and there's evidence that within that school building, there's transmission in the schools, all right? So that's a lot of what our busy nurses are doing when they call. Unfortunately, they call and a lot of people don't answer. So it's a challenging job to differentiate between community transmission and transmission that's occurring in a school. So we'll just continue to really, although I do want to say our school partners have been excellent. They're not blowing this off. Every school that I work with, have been working with in the last 2 years, really is trying very hard to keep an eye on things. This is why we've already had a couple of schools that have changed course, have paused, or have instituted other mitigation factors. It's because they were having in their own environment problems that seemed to exceed what was happening in the community itself. So that's kind of where we've been looking all along to recommend other mitigation strategies. The second part of your question is has 65 and older. 65 and older had the FDA approval. ACIP is meeting right now as we speak. I believe they had a vote just about a half an hour ago. Haven't heard. So the ACIP is the independent immunization panel that gets together and looks at all the data. And quite honestly, until the ACIP votes, there is no final approval or published recommendations, and that is what we wait for as a healthcare facility and what your doctors wait for before they start providing vaccine. So 65 and older, and it may be some other groups as well, high risk groups. We'll see what the ACIP votes on today. But when? Probably as early as next week, I would think. And we'll get that word out and start talking about it. You can get your vaccine exactly where you got it before. And by the way, this is going to be only for Pfizer, okay? I don't know what to tell you yet about those of you who got 2 doses of Moderna, whether you should get a booster dose of Pfizer. So that's a big unanswered question. I don't have the answer just yet. That's something hopefully ACIP will kind of weigh in on. So right now it's for Pfizer booster dose only. We were saying 8 months. It looks like they're going to say 6 months, but it is the same dosage and the same product that you got for everything else. So you could get it in all the same places you got it before. You could get it here. You can get it at the pharmacy. You can get it at your doctor's office if they're carrying it. So more to come on that.
All right, next question is from Maureen. Are students that have been exposed to COVID allowed to bypass quarantine if they agree to wear a mask in school?
No, they have to be masked before they're exposed. So the masking prevents the transmission and reduces the transmission of the disease. Once the exposure occurs, it's really just a matter. The quarantine is that time frame we allow to see if they become positive and will go on and inadvertently transfer it to other people. So we're allowing vaccinated individuals to bypass quarantine if they're wearing a mask. But if you're unmasked and unvaccinated, then you probably have to opt for that 7-day or 10-day option.
Okay.
And that, I'm just going to say quarantine piece is there is no definitive data anywhere that can really say this is the right thing, this is the wrong thing. So we've tried to take best practices, the best information we have, and try and weigh that risk benefit. Because remember, the more kids you let continue to do in-person learning, the greater the transmission rates will be, because there'll inevitably be people that'll be positive that won't know about it. So we'll just keep looking at that. And I know it's frustrating, but we'll just keep trying to keep it down to the minimal amounts that we can.
Right. And Maureen, we can share that quarantine graphic with you too that explains it a little better. Becky is the next question. Please explain to the audience why the CDC isn't on board yet recommending the boosters.
Well, boosters is a big word, okay? So let me just go over that again. So as you know, there's been approval for a 3rd dose of vaccine for immunocompromised people, because we know there is a certain subset of people, immunocompromised people, who don't mount as good of a immunity response to the vaccine after 2 doses. So they say, okay, for this group of people, you need 3 doses to have a full, robust immune response. And this is true for many vaccines. We have 3-dose series, right? So the boosters are what you use if the immunity isn't long lasting and it starts to wane over time. And we know that COVID immunity does wane over time, both for natural and vaccine-associated immunity. And so the discussion is just going on and on about, well, how low is important? At what point? We know the antibodies go down, but immunity is not all antibody driven. It's also it's also driven by some cellular components that we can't easily measure. It's complicated. It's and then there's access to vaccine and the ethical issues of the fact that 50% of our population is not vaccinated still. Parts of the world, barely 10% of the population is vaccinated. And this is a worldwide pandemic. So unless you control transmission worldwide, you really don't have the hope of damping this whole thing down and keeping these surges from happening over and over again. So the Pfizer data, the Moderna data, and even the J&J data they all have to be carefully looked at in this context of equity and effectiveness and the risks associated with it. and I don't know if I'm specifically answering your question. Maybe you're thinking about some other areas, but the idea of booster doses is just it's just a really complicated area.
All right. Next question is from Jonathan. So what do you do to all the doctors and nurses that won't get the vaccine?
I don't do anything. So what do? You try and educate. This is my approach. Everybody who doesn't want to get a vaccine, of course, maybe yeah. So I figure if they don't want a vaccine, this means they don't really understand the benefit and the value of the vaccine. Because I think the information out there is overwhelmingly supportive of getting vaccinated. But if that's not enough, if they're kind of stuck on something that they can't kind of get over, then quite honestly, you have to compare that fact that they're at much greater risk for infection. What is their job responsibility? Can they protect themselves in other ways? There is personal protective equipment, right? We know that if you wear PPE correctly with the face shield and the N95 mask and all that, there's a fair amount of protection that you can get from that. So are there other mechanisms that we're talking here about healthcare providers, but really anybody who's working with vulnerable people to prevent them from actually inadvertently getting infected or infecting someone else. These things are being grappled with all over the world, and in our county, no less. Some of our hospitals have said, no, if you're not vaccinated, you can't do this kind of work. And some hospitals are just trying to kind of move people in that direction gradually. Internally at the health department, we're just trying one-on-one to get all of our staff to understand what we know to be true and what we believe in and walk that walk with us. So that's where we're at, and everybody's kind of moving in whatever direction they can to get there.
All right. Next question again from Jonathan. Do you disagree with CDC survival rates if you were to get COVID?
Well, epidemiology is epidemiology, and I've said this a million times. We're dealing with a emerging pandemic where the data is real time. We haven't had a decade to look back and scrub it and set up clear placebo-controlled trials and all the things we do in medicine to really get a very clear picture of all these details. The question was survival with COVID. We know that COVID infects very easily. It's a highly especially the Delta variant, highly contagious. Of 100 people that get COVID, and that data is a little hard to understand and depends on the population, but anywhere from 20 to 40% can get severely ill. And out of those, we have a 2% mortality rate in St. Clair County. That's a lot of people. That's much higher than what the mortality rates we get with other infectious diseases, other viruses. So I'm not going to hang my hat on a number other than to say that we know this is a very compelling virus as far as the impact it can have on populations. And as an individual, I got to say, you take your chances sometimes with this stuff. How lucky do you feel? If you're unvaccinated, I would be very concerned. I'm concerned as a vaccinated individual, as a 60-year-old woman with underlying health conditions, because I know if I were to get reinfected, my risk of having a more serious infection would be higher than somebody else. So, I'm not sure how to really answer that other than I just take it very seriously, and I'm not going to squabble over a 1% or a 2% or a 0.5% rate. I'm just going to say that that's a lot of people and a lot of morbidity, a lot of pain and suffering going along with this infection.
All right, Doc, you're just getting some thanks from people. First one is from Lisa. Thank you for all you do. You are all doing the best to keep us all safe, and you are appreciated. Thank you, Lisa.
Thanks.
Next question is from Kathy. Are people having trouble of this forum freezing up? I don't think we're freezing up. Let us know if we are.
Apologize.
Yeah.
We always have technical difficulties. I'm sorry. We do the best we can with that.
Let us know and
How
we'll
many of
try
the
to
new
keep it.
cases are in kids under 18? Brandon, I'll let you. Uh,
Yeah.
I think you just told me that, didn't we say out of the?
Well,
I forgot
yeah,
the numbers already.
that's
Yeah,
a yeah. So it's sometimes people will include 18 and other times we won't. But if we're just looking at those under 18, so 0 to 17 for the month of September, that's 155 cases.
okay, and that's not a complete month. Okay.
Right.
And I would venture to say, remember that the cases we know about are the people that have had confirmed testing and have ended up in our system. Okay, so for every case we know about, there's easily more. I don't know whether it'd be two or three more. It would depend on the community transmission rate, but there's easily more cases out there. So just keep that in mind.
All right. It looks like other people are reporting no issues, so it just might be that one person's connection. All right, Doc, we're at 4:02. I know we started late. Are you comfortable with us going a little bit longer?
Sure. Yeah.
Okay. All right. Next question is from Corinne. My husband and I are vaccinated, but my daughter is only 11. What are your thoughts on the vaccine for children? Any prepubescent issues after receiving? I'm a bit nervous, but feel it's the best route to keep us all safe.
Yeah, there's no question that there's a lot of people looking at those trials. The clinical trials for children have been demanded. There are no shortcuts on clinical and safety trials for children. So when we get that information and when the vaccine is looked at for safety, we will know that information. What I'm hearing so far is that the vaccine is effective for children. It will be a different dose, and that the adverse side effects are similar. So, upwards of 70% of people have this sore arm and low grade temperature, etc. So, if that's similar, you can assume that for kids, they're going to have that same kind of post vaccine blah, and that is the price you pay for not having a real infection.
Okay.
But we'll have more data on that. And by the way, timing wise, what I'm hearing is perhaps October we're going to hear more about pediatric dosing. So it's coming.
Okay. Next question is from Maureen. Can children who are too young for vaccination receive monoclonal antibody infusion if they get COVID?
No, I think the monoclonal is only indicated for 16 and over. I'll have to double check that, but unfortunately that's part of the problem. Now, the good news is young children generally, it's rare. When they do get real sick though, I don't believe the monoclonals, but if they're real sick, they're in the hospital and that's way beyond the monoclonal issue. So I'm assuming you're talking about a young child that has a high risk condition. The best way to protect a child who doesn't have the ability to be vaccinated, whether the vaccine's not approved or whether it's not a choice, is to vaccinate the people around them. So those adults that are really kind of hesitating about getting their kids vaccinated or whatever, just vaccinate all the people around them. The data is very robust in that area, that households that are fully vaccinated those kids are markedly more protected than kids that come from households that aren't. And that just makes sense, right? With a communicable disease, the less it can spread, and the highest risk place you can get infected is really in your domestic situations in your homes, right? Because you're there, you're eating together, you're talking together. So that's where most of our cases do end up coming from, is from households. So if you're worried about your kid, make sure that your household is vaccinated.
Okay. All right. Next question is from Darlene. Is it okay to get the flu shot close to the same time we get the COVID booster shot, or do we wait?
Yeah, no, it appears that there's no problem getting the influenza vaccine with your COVID vaccine, whether it's your first, second, or booster dose. So I would get them at the same time just to get it over with. They'll work as well. The risk of side effects is no different combined versus separate, and you get it all over at one time and you don't have to come back. What we do know is when people have to make multiple trips to the doctor or the health department for vaccine, it tends to get blown off or delayed. And we'd like most people to get vaccinated for flu by the end of October, since we've had early flu seasons as early as November. So get that flu shot either now, or if you're going to wait for your eligibility for the booster, get it at the same time is what I'd recommend.
Okay. Looks like there's some other questions about the natural immunity. We covered that at the beginning of the show, so watch it back. At the very beginning, Doc covered that.
And I think that's covered really nicely on our FAQ section. Did we get that up yet, Elise?
I think that should be going up tomorrow. That one,
yeah,
that one should
we've been working on that all week because there's been a lot of questions about that. And the other piece that we talk about a lot is getting blood tested for serology for antibodies, and why we don't recommend that, and why that's not a reliable way either of identifying whether you need a vaccine or not. So I hope that the answers we have are clear, and if not, just shoot us another email with what we haven't answered, and we'll try and get back to you about that.
All right. This next question is from Tracy. If my child wears a mask to school all day, every day, and is exposed to a person or to a positive non-mask wearing student, does my child have to quarantine? It looks like she would have to based on the chart. Can you clarify?
Yeah, that was a tough question. And I'm sorry, Tracy. I know there's a lot. The real question is there's not a lot of solid data about that, but we do have data on universally masked classrooms versus non-universally masked classrooms. And so we'd have to put your situation in a non-universally masked classroom, right? Where there was individuals that were unmasked and then yours was. Now, I do think your child will hopefully fare a little better. But remember, masking is really most effective as a source control. It's really most effective so that you don't infect other people. If you have an asymptomatic infection, you don't know it yet, you're much less likely to expel enough virus to infect other people. There is some protective effect on a mask that you're wearing from other people, but that depends a lot on the type of mask you're wearing and how you're wearing it. So to answer your question directly, no, unfortunately, your child wearing a mask wouldn't impact her quarantine requirements, but it would benefit her, okay? And it's still a good idea, and I'm still hoping that people will start choosing to protect themselves and other people because they want to protect themselves and other people, not because I say so, or the health department, or the state health department, or some order. It's because we don't want people we care about, or even people near us, to be sick, right? So every person that kind of decides to wear their masks and to follow these policies that we're talking about, maybe there's a synergy there that can just kind of grow out of human compassion for each other. And so I thank you for those of you who are trying so hard. I struggle with people who are fighting to allow their kids to have more exposure to an infection. That doesn't make any sense to me. I think we should be fighting for our kids not to have exposures to infection. And we can do that and still keep them in school, which is really kind of the most challenging part of this fight, right? Is because there's no question we can balance their ability to stay in school with markedly reducing their exposure risk. And so I'm hoping we can get there as a community, and we can do it because we're urging each other to do the right thing.
Okay. Next question is from Melissa. Do you have the power to quarantine anyone in the county or just children in school?
Oh, the power. Yeah, no, I have the authority to quarantine anyone in the county. We generally have not, and that's a big question right now. So have we enforced quarantine for anyone? No. Generally, quarantine enforcement we've done in the past related to TB cases, HIV cases. It's rare when we would go through that effort. But quarantine letters are required to be sent out because of due process. And that's why those letters were sent out with the actual language of the law kind of extracted and put in there. Now we've softened that because our intention is not to scare anybody, but to inform them that quarantine is in fact a legally enforceable public health action. And it's been embedded in our laws for a long, long time because if people don't want to do what's needed to prevent harm to other people, there's a process there in place that we can try and get them to kind of move them away from harming other people. So the quarantine orders are there to improve compliance, and they're there in case there's a really egregious, difficult situation where we're really having a lot of risk being done from some individual. So I think your question, I over answered that question. Sorry. But a lot of pushback about that. And I'm just going to say that quarantine is the right thing to do. It works. We know that people in quarantine have a lot less exposures. We know that about 30% of our cases were in quarantine when they became infected. So we know that there's a true value. And so the whole legal side of making somebody do it is really, I don't think the thing we should be talking about. The thing we should be talking about is how we can do this as a community and still function well and still minimize the risks of lost schooling, lost work, and all those other things that are so difficult to do.
Okay, I want to be mindful of your time, Doc. This will be our final question. For those who did have other questions that came through, can email us at covid19@stclaircounty.org, and we can try to run through these questions at the end too and answer the ones Lauren and I here and type them out. So last one's from Corey. Is there any historical example of an individual gaining better immunity via immunization than from previous infection?
Oh, that's really tough. I would have to say, yeah, probably. I would have to really kind of research that and think about that. But vaccines are tremendously successful, but they vary a lot from individuals. They vary a lot from different diseases. I can say this, that in general, I can say in all situations, vaccines provide immunity without the risk of a natural infection. And if that weren't the case, we wouldn't vaccinate, right? If the natural infection just provided immunity and people didn't have any real problems with the infection itself, then there would be no need for a vaccine. We only vaccinate when the natural infection itself has such a negative impact, whether it be death or some other issues related to prolonged illness or long-term health effects, that we use the vaccine to prevent the natural infection. So you pay a price with natural infection, even in fact, if the immunity is somewhat better. So sometimes that immunity is better, sometimes it's not. I'd have to really, and I'd have to say, I'd have to really study that one to give you clear answers on which is which. But in all cases, natural infection is much riskier and more harmful than getting your immunity from a vaccine. And then the corollary to that is that a vaccine that is cheap and effective can be applied to an entire population. And then you have the opportunity of wiping out that infection altogether, which you can't do with natural infection. Natural infection just hits people. They may be protected as an individual, but the population that they live in isn't protected from their immunity. And so that's the other side of vaccine that people overlook. It's not just about your personal immunity. It's about the fact that vaccines properly applied to a population can take that infectious disease right out of the picture. Like, we don't even have to think about it anymore, which is a remarkable, remarkable thing in medicine, and something we can't underestimate the value of.
All right, Doc, any closing comments?
Stay dry. It's cold and rainy. Yuck. No, just hang in there with us. Public health is strong. We're going to stay the course. I know that there's, we're under fire, lots going on, but we know our job, and we're happy to be here, and we're honored to try and improve the health of our community. And we are going to continue to do our job and work hard to do it well and to do it right. So thank you for your support, and thank you for challenging us to stay on top of the things we're supposed to stay on top of.